A disturbing finding in some younger patients with the COVID-19 coronavirus. They could have deadly consequences. Medical reporter Liz Bonus shares a rare but dangerous discovery in blood clots, raising the risk of stroke.
I'm going to take your temperature.
Okay. There are many reasons some patients have still needed in-person visits in this COVID-19 crisis with gynecologists. But now Dr. Amy Brenner says there may be one more.
Many gynecologists prescribe medications that already increase the risk of blood clots, such as birth control pills, oral estrogen. So those medicines we already know increase the risk of clotting. And we also know that this COVID-19 is doing some weird things to the clotting system.
In fact, a new study about to be published from multiple medical centers shows the virus could raise the risk for stroke in younger people due to blood clots that can form anywhere in the body. Dr. Andy Ringer of Mayfield Brain and Spine and Ohio's TriHealth Neuroscience Institute told me it is likely due to one of two things.
Is it because COVID is creating blood clots in these patients and causing them to have the strokes? That part's not quite so clear. It's really hard to draw conclusions like that on a small number of patients. However, the other phenomena that's also brought up in the same study is the question about delayed presentation. We're seeing about, on average, 2-hour delay in presentation compared to the same time last year.
So possibly here there's a broader message. If I am having a stroke, are there common symptoms?
The classic warning signs for stroke, we call them FAST, face, arm, speech, time to call 911.
And even if you feel it's not urgent, this reminder today from women's health provider, Dr. Amy Brenner.
Should something be done to possibly mitigate that risk of clotting?
I'm medical reporter Liz Bonus reporting.
All healthcare centers have been open for urgent stroke care and intervention during the pandemic, but the American Heart Association says some patients aren't seeking care because they're afraid they'll catch the virus if they go to the hospital.